Good evening, everyone, and welcome to our Monday Night Live. We are going to start off with a word of prayer. Heavenly Father, we give you thanks for this day. We thank you for the opportunity to be able to discuss this important topic. We pray that it would be beneficial to many. This is our prayer in Jesus' name, amen. Okay, so we're talking about dengue. And that's our topic of discussion. Let's talk dengue, the facts, prevention, natural remedies, how you can prevent and take care of yourself, even if you were to contract this particular virus. And I just want to ask in the chat whether anyone has had an experience with dengue. Have you had it in the past, or are you battling with it right now? If you would indicate dengue. Okay, let's see. Yeah. All right, Taryn, you have had dengue before. I know some folks who have had it, and you hear a lot about it in the news. Whoa, many times. You're probably immune, but we discuss immunity and yeah. And your son had it last week, Hackett is telling us. All right, so it's quite close to home for many. So let's see, I'm talking to you from Pure Wellness Lifestyle Center in Trinidad and Tobago, located in Trinidad Island. And here it's where we run our residential program for individuals, and we do health education to the public as well as one-to-one consultation and training and many other things that you would hear about in due course. But keeping with our topic, we are looking at an overview of causes, symptoms, prevention, and remedies. Causes, symptoms, prevention, and remedies. So what exactly is dengue? It is a mosquito-borne viral infection, and it causes fever. You get body aches. It can become severe. You may have a mild form or a severe form. And if it is severe, you find that you can have bleeding. And there you get into that area where you may be told that you have dengue hemorrhagic fever. And it is prevalent within the tropical and subtropical regions. So when we look at the world map, and this was published just last week on last month on June 20th. And here you see the different areas of the world where you have frequent outbreak of dengue. And you may be able to identify your country on this map. And you see all the warmer areas. As it gets colder, the mosquitoes don't like the cold. And but in the warmer areas, you find dengue quite prevalent. And it's about 50 to 100 million cases of dengue and about 20,000 deaths, unfortunately, that occur worldwide. And I just pulled some stats. This was last week with Trinidad and Tobago, where our local Ministry of Health, they made a statement saying that there were 450 laboratory confirmed cases in this country, and we also had 4 laboratory confirmed deaths from dengue fever. And that's a lot. I mean, for individuals, one, to be unwell, and then secondly, the loss of life. That is something that we would certainly want to avoid perpetuating. So the message is, let us be aware and let us be cautious. Let us take whatever steps that may be necessary to prevent. And if it is that you do contract, know the symptoms, know the signs, and take appropriate action immediately. Now, many factors have contributed to the spread of dengue. You have climate change, where you find out the weather is just warm, more warm than before. And certain areas that might have been cool, it's now hot. And therefore, you find that mosquitoes tend to thrive within these warmer climates. And then you have the spread of mosquito that carries the virus, and you have more outbreaks. I just want to show you the life cycle of dengue mosquito Aedes aegypti. It's the specific type of mosquito that carries that dengue virus within its body, and that can transmit to others. So transmission is through the form of being bitten by an infected mosquito. So I'll just pull it up. It's a little video on YouTube. So let me know if you all can hear.
It takes 7 days for an Aedes mosquito egg in stagnant water to become an adult Aedes mosquito. The water has to be clean, and only a thin film, no thicker than a 20-cent coin, is all. It takes 7 days for an Aedes mosquito egg in stagnant water to become an adult Aedes mosquito. The water has to be clean, and only a thin film, no thicker than a 20-cent coin, is all that is required for the Aedes mosquito to breed in. Its growth begins from an egg to a larvae to a pupae, and finally to an adult. An adult mosquito can live for about 2 to 3 weeks. Only the female Aedes mosquito will bite to extract blood in order to support the production of eggs. If the blood meal is insufficient, she will keep biting until she has enough blood. On an average, she produces 3 to 4 batches of eggs in her lifetime, and about 70 to 80 eggs per batch. Male mosquitoes feed on plant juices and do not bite, as they do not need to suck blood. In its search for blood, the female Aedes is attracted to carbon dioxide, body odor, and body heat. With less than 5% of the skin being blood vessels, the mosquito searches for them by probing the skin with her proboscis. Once a blood vessel is found, the female Aedes mosquito freezes and starts drawing blood from it. She will release salivary secretions to prevent the blood from clotting, allowing the mosquito to feed efficiently. It is this mosquito saliva that will cause the itchy red lumps in the victim. The amount of blood a female mosquito can take at one time can be up to 4 times its own weight. And to fit all the blood in her stomach, she will discharge the liquid content of the blood from her abdomen. Having taken a full blood meal, the Aedes mosquito will find a place to rest before looking for a suitable habitat to lay her eggs. When that is done, she will look for her next host again. When a person has a dengue virus in his bloodstream, the female Aedes will suck in the virus with the blood. It will take another 7 to 12 days for the virus in the Aedes mosquito to reach her salivary glands. Once the virus has reached the salivary gland, she will be able to transmit the virus to other human hosts. The risk of dengue transmission with the possibility of a dengue outbreak occurs when the infected mosquito begins to bite many hosts.
Okay. All right. So there you see that overview. I think it gives us such a clear description about how this mosquito operates. You know, the male, they can care for blood. It's just the female who has to lay the eggs. And one of the things that I want you to note is that when it injects the little injector into the skin, that it would release a certain material, a certain chemical that dilutes that blood, thins that blood, and in order for it to have the uptake of the blood. And there is why you find the platelets being so low within individuals who have the dengue virus. And that would be important as part of helping you to recover, because it causes weakness within the body. So, just a second. Maybe it's running again. All right, so let's look at the causes. And so you have the virus, and note that there are 4 types: dengue virus 1, 2, 3, and 4. And each of these are different in a way. And you can have, you could contract a dengue virus 1 or dengue virus 3 or 4, and build an immunity for any specific one of them. If you've gotten it before, you can have an immunity for the dengue virus 1. If you've gotten dengue virus 2, you can build an immunity for that. But the immunity for any single one of them does not cross over to the other. So that's why you find the repeated infections that can take place with different severity, because number one, if it is that you are reinfected too soon, you can have the dengue fever, where you're more advanced in your state of being ill, or it very well may be that you have contracted a different type of dengue virus. The mode of transmission is from infected mosquitoes, primarily from the Aedes aegypti mosquitoes and the Aedes albopictus. And so these are mosquitoes we want to stay far from. Just as a note, it is uncommon, but it has happened before, where a pregnant woman can pass on the dengue virus to her fetus during her pregnancy or around the time of birth. And so you find that there has been a report where through the breast milk, they identify the dengue virus. So everyone needs to be so cautious because you don't want a baby getting unwell from the dengue virus. Now, there are risk factors for dengue, and it depends on your geographical location, as we showed you that world map. We're also looking at children can be quite susceptible because they are not looking out for mosquitoes or taking the necessary caution like an adult would. And the adults have to take care of children and to make sure that we cover them. And then the immune status of the individual, if that person is compromised, have some immunodeficiency condition, then that person may very likely be able to be at a higher risk for getting dengue. And having a prior infection that can increase your risk of getting a severe dengue if you become affected too soon, or even from a different type of the dengue virus. So what are the symptoms that we are looking at? And let's see, we had Taryn Antoine. If you would like to unmute and share with us your symptoms that you experienced, then we would be able to identify with you as we look at the symptoms. Taryn, are you there?
Yes, good evening, everyone.
Hi.
My symptoms were more or less pain, headaches, pounding headaches. My eyes would, I'll get a lot of pain in the eye.
Mm-hmm.
I would feel tired, very tired. Yes.
Okay.
And weak as well.
Mm-hmm.
I would have that probably, I had that from last year. Maybe I'll get it like twice or three times for the year.
Wow.
Yes, so I'll feel very, but I don't have I have a slight fever, but not very feverish.
Okay.
Yes. Mhm.
And how long did it last for you on you?
Since I would use the purple leaf, it would
Mm.
last maybe about 2 weeks or 3 weeks, but I was just scared that I was getting it way too often.
Right. Yeah. Okay. Well, very good. We're glad that you're still here with us. And God has blessed you to preserve you and even through your ordeal with dengue. And thank you so much for sharing. And everyone note how that there was some form of weakness. And Taryn, which country are you at?
Calling from St. Lucia.
Okay. All right. So it's right here within the Caribbean and very much a part of what we're looking at here today. Okay, great. Thank you so much for sharing. All right. So the incubation period can run anywhere from 3 to 15 days. So individuals, when you sort of identify your symptoms, note that it didn't happen with any exposure yesterday. All right. That would have been anywhere like 3 days to a week or 2 weeks prior that you would have been exposed to this mosquito that would have infected you. And let's look at the symptoms. Taryn had the eye pain, and then she also had the headache. So very much in the head being impacted. And there are some other symptoms that you need to be aware of. We have muscle pain, bone pain, break bone fever, because a fever comes and your bones, if your bones ache you, that is the most excruciating pain that could be. I remember during COVID time that I got COVID-19 and that bone pain was awful, or muscle pain, muscle bone, and it really feels like your back is breaking and you twist and toss and it's painful. Joint pain, and then there would be some form of fever, and headache, nausea, and vomiting, as well as rash breakout on the skin. All of these are different types, and individuals may not have all of these symptoms, but they may have a couple of them. A good question. So how can I tell the difference between COVID and dengue? And yep. Well, we know that it is a virus, and that's why we're going to be addressing it. So if you have mosquitoes within your area, then you know that there is a possible risk. And also, if dengue is prevalent within your society, then it certainly should be considered. Testing can also be helpful in identifying which of those types of viruses that you have. So how long will it last? And anywhere for about 2 to 3 days, and then it subsides in its severity. People usually feel well for about 24 hours, and then you might find that you feel unwell again. The fever may return, you may get a rash. So it sort of gives like a seesaw kind of effect. You probably putting efforts into taking care of your body, and you have a boost feeling, and then you can feel low. But really watch and see to the end that it stops for you. People with more severe cases can feel weak for several weeks, and even after they have overcome other symptoms, weakness may linger. And it's very important that we work on the blood, cleaning the blood and building you up, building up your blood levels. So the rash, this may take place on the face, on the hands, on the torso area of the body, sort of looking like a flush and bread type of rash. The lymph nodes can also be swollen because you're fighting off an infection here. And dengue sore throat, gastrointestinal symptoms may manifest itself. You may have nausea, vomiting, and hemorrhagic symptoms where you have some form of bleeding that might be in your gums. And you also find that Guillain-Barré syndrome sort of effect where you find individuals may have seizures and then they lose control of their limbs. And it just seems like it's moving from one limb to another where you're losing that control, and it could develop into these conditions. So therefore, it's super important that we watch this virus. What are some of the things to look out for if you have this dengue hemorrhagic fever where it's progressed to fever stage? This is a more severe form of dengue, and it usually occurs in children under 10 years of age. And if they're living in an area where you find that the dengue virus is common, and it can happen with other individuals if they get a second hit at the dengue virus. So you get reinfected, your body has been weakened, there's some strain of the virus already in you, and now you're getting it again. And that can heighten the severity for you, and you can suffer the fever. And so your immune system would need to work really hard for you. And you find that with the dengue hemorrhagic fever, this reaction can damage the blood vessels. And so you have the leaking of blood fluids, and that can also leak into your lungs and cause difficulty with breathing. So there we need to go to the hospital, go to a medical facility where you can get help. If you have respiratory issues, that's pretty serious. You find that bleeding from the nose, the mouth, the gastrointestinal tract, and even certain wound areas may start to bleed. People may vomit up blood. You might find under the skin, you just seeing blotches of squashed blood, spilled blood that sort of shows up in a purple bluish look. And without treatment, what you find is that your blood pressure can drop too low, and it can result in shock reaction in your body. Having dengue hemorrhagic fever is quite a medical emergency, and therefore you need to seek that professional medical care. Do not stay home and just keep nursing it. If you've gone to seek medical attention and you're sent back home because you've been given some form of help, then you're home and you can continue to take care of yourself, doing certain things to reduce fever. However, you find that individuals can die because you're having this loss of blood. So the fever is one thing, but having a hemorrhagic fever where you have the bleeding, that is a condition that they would need to stem. Okay, stop that bleeding, manage the fever, get rid of the virus manifesting itself within you. And so let's have a little picture look. Dengue fever, you will have headache, muscle pain, joint pain, bone pain, again, rash. All of these will still be there for you, but you find that there's some other situations going on, edema, black tarry stools, and problems with breathing and so forth, confusion, restlessness. All of these can be a symptom of hemorrhagic fever. So the diagnosis, someone just, okay, thank you. Sister Dakota is sharing that you can also pass blood in the urine as well. Good, so that you may see the trace of the blood as, yeah, that might be quite evidential in addition to testing. So a diagnosis of dengue, it will require a blood test. And so the doctors, if they suspect dengue fever because you're living in an area where it's prevalent, or you've recently traveled from an area where dengue is prevalent, and that's another way in which the dengue virus can spread through people traveling from one area, country, state to another. And it's usually diagnosed by the blood test looking for antibodies to the virus. And these antibodies will identify the dengue virus. Now, there's a standard treatment within the medical world, allopathic medicine. You're looking at pain relievers. So you have these aches, body aches and pain around in your body. Pain. Now, one of the things that Taryn mentioned for her symptom is that she felt tired. And I've seen where tired and weak, where individuals feel tired and weak and they're unwell and they just want to be so comfortable in bed and not get up and move. And that can be, you know, a trap for you. You want to sleep and you would not get up and drink fluids enough. So don't, you know, you need a lot of mental force and mental power and willpower if you're feeling tired and weak, if you're unwell, to say, okay, let me follow the instructions. Let me do what I need to do because I have to fight this. If you lay down, it's going to take you. You're going to get severely unwell. So you gotta fight it. You gotta wake up, you know, rise up. People may be helping you, but at the same time, you need to cooperate and help yourself by, you know, taking the different aids. So having a lot of fluid, if it is that you have dengue hemorrhagic fever, you need to hydrate because you're going to be burning up and losing fluid volumes within your body. So hydrating is important. You're going to be drinking lots of water. We also look at coconut water. That would be helpful, and fruit juices. Yesterday evening, I chatted with a young man that I recalled had dengue many years ago, and I asked him, what did he do? And he shared with me that he just went on a fast of fruits and juices and water. And when he found out that he had dengue, you know, he did not eat any cooked food because at that time, your body, it wants to use its energy on helping you to heal and to recover, as opposed to working on digesting food. As a matter of fact, you may not even have an appetite. And that's important for caregivers to know that when individuals have viruses, they may not have appetite. So don't force them to eat solids. Work on lots more liquids because they don't have the energy and they don't have the mind. They have no taste. And so by just giving them the liquids, that might be more tolerable for them to ingest. So you want to hydrate yourself, get adequate, not overly too much, but adequate bed rest and bed rest enough that you can still do what you need to do and be rested because you want your body to heal. And consult a doctor if you are not getting better within 2 to 3 days. If you're getting severely worse, go see a doctor. As a matter of fact, it's good if you suspect that it's dengue, go and be tested, go see the doctor, make sure what your your suspicion, is have that confirmed and get the necessary support during this time. Okay. All right, so someone is sharing in the chat that her daughter was at the time 7 years old when she got dengue, and she could not go for treatment, but they gave her lots of water to drink, grape juice, coconut water, keeping her hydrated, prayed, and all worked well. Okay. All right, she was hospitalized. Okay. And I also had dengue and could not go. Okay. All right. So, but the hydration really helps. And as you see through the experiences of many individuals. Now, there are certain don't use aspirin. What would aspirin do? Thin your blood again. And so you don't want to use aspirin or ibuprofen for fever or body aches. And especially for children, should not be using aspirin even in the midst of having a fever, because that can cause some issues for them, turn into Reynolds syndrome. So do not use antibiotics unless prescribed by a doctor, and do not use steroids or unless prescribed by a doctor, and do not avoid using blood transfusion or platelets unless indicated that you really have a need to do so. So taking things on our own could be harmful if it is that we're not addressing it from a right perspective, and therefore we need to watch this. Work along with your healthcare provider who've been working with others and quite regularly. Okay, so warning signs. If present, immediately consult a doctor. If you have these red spots on your skin, bleeding from your nose or gums, frequent vomiting or vomiting blood, abdominal pain, pale, cold, or clammy skin, all of these are signs that are manifested. Go consult a doctor. Think, where are you? Within an environment where dengue is prevalent, your healthcare providers are looking at this. It very well may be that you have contracted the dengue virus. Let's look at modes of prevention. And yeah. Okay, with regards to antibiotics and steroids, that's a standard of care not to have those because they can interfere with the function of the blood, and you want to be able to follow a certain course. So let's see. I wonder whether we have on the line Brother Diaz, Harold Diaz. Are you here? Okay, yes, you're here.
Yes, I'm online.
Okay, great. So Brother Harold Diaz, he lives in a repo village within Trinidad. And, I asked him to come share with us, what he might do from a local perspective in terms of helping someone with dengue, but also he wanted to share with us modes of prevention and how do we need to take care of our environment. So just a second, right. So we're just about there. So Brother Diaz, you go ahead and share with us how we can take care of our environment.
Well, first of all, Doc, thank you for the invite. Thank you for the opportunity, and it's a real pleasure actually being here tonight. Environmental factors, we understand, well, all right, so this virus is spread by mosquitoes. So of course you don't want to really create an avenue for mosquitoes. All right. I think it's common sense that we need to understand that mosquitoes require a certain environment for breeding. So we really need to be proactive, look at the environment carefully. If you suspect that there is, you know, an area where these mosquitoes may find themselves comfortable, you know, to breed, then obviously we definitely need to be proactive to ensure that we don't create an avenue, you know, for such. All right. I would also suggest that, of course, the time in which we live, we also need to be more proactive in terms of creating an environment in our bodies where our immune system, you know, can strive. I think that for a lot of us, you know, we are guilty of breaking the laws of health, you know, and as a result of such, we find ourselves in a situation where our immune system can't really protect us. You know, so we need to do some work, of course, in that area also. I know that for a lot of us that are here, I even feel safe to probably say for all of us that are here, we are very concerned about our health and about the health of our loved ones. So keeping in mind that, as commonly thought by a lot of health professionals, you know, every single disease known to human basically starts in the colon. I think that we need to also understand that before it reaches the colon, it basically starts in the kitchen. You know, so it's important to create that environment in our bodies whereby our immune system, you know, can develop and keep strong. As we look around us, we see that there are other environmental factors that I suppose if you look hard enough, you can definitely, you know, discern that there are things among us that, or around us, that is not exactly normal. I'll give you an example of it. Sometimes when I go into this mode, some people may look at me and say, well, you know, conspiracy theorist, but I think that everybody would agree that we now have daily, almost daily warning of Sahara dust, you know, and interestingly enough, we only started having issues of Sahara dust just about in 2020. I don't know how many people would remember that or probably even agree with that, but only from the year 2020, we started seeing Sahara dust in the rainy season. And strange enough, we having a lot of rain. We're having a lot of flooding. You know, we are having so many things going around, so much moisture in the air, but yet, ever since 2020, Sahara dust have become very prevalent, almost on a daily basis. And I think that is something that we ought to keep in mind. Strange enough, of course, as I always say, the Sahara Desert doesn't have any dust. Sahara Desert is predominantly sand. But anyhow, I suppose that's a subject probably for another day. But as a people, we have been blessed with a lot, of knowledge, especially when it comes to the area of health. We have been blessed. I think that we take for granted the information that we are privy to, you know, and I think for so many of us, we don't even consider taking seriously a lot of the warnings that we have been given, you know, by the pen of inspiration. I always like to point Seventh-day Adventists to the great controversy down to the final chapters. I think it's chapter 39, entitled The Impending Crisis, you know, and one of the things that's been pointed out there is the fact that Satan will release into the air a deadly taint. And the prophet of the Lord described the results of that deadly taint, you know, and she indicated that, you know, all of these pestilences and diseases and stuff like that, you know, the results of these things will become worse and worse and worse as time go on. You know, and when I look around me today, because I generally tend to take things very literal. So from the first time that I read that passage, I've been kind of looking out for that deadly taint. And to me, from what I can see at the moment, you know, she never said Sahara dust, but that's the only thing that I could see in the environment at the moment that is not natural to nature, you know. And interestingly enough, ever since 2020, for people that's been analyzing, you know, what's been taking place, I think we could all agree that ever since then, things have not quite been the same. All right, we are seeing a lot taking place around us, a lot of deaths, heart attacks, strokes, a lot of sickness, you know. So I think that it's safe to say that yes, these pestilence and all these things are becoming worse and worse and worse, even as the days and the months go on. And it is predicted, you know, to become even worse, you know. So the environmental factors, there is so much that we can do, you know, that can make such a difference in our health. And I think that's it's an error to sit down and to think to ourselves, well, you know what, I'm going to get started tomorrow. No, no, no. This is not an issue that is going to wait for us to be ready. I really think that as long as we are convinced that, you know, we have to work on this, then the time to work on it is like now, you know, immediately.
Yeah, totally agree. All right, great. And is there anything specific? Have you you know, advised or anyone with dengue fever even as to what they can use that's natural?
Yeah, definitely. All right. Of course, everybody, well, maybe not everybody, but I think the majority of people have already got the news flash that fresh pawpaw leaf juice is definitely a big help. That's one of the areas that I strongly recommend. I've had a couple cases within the recent past that I've had to help with, and I have to say that the use of the pawpaw juice has been a blessing to these individuals, you know. And in one of those cases involving a gentleman, you know, his blood platelets was dropping like crazy,
Mhm.
He started the purple leaf juice, and by the following day, he was basically discharged from the hospital. Now, it doesn't always work that quickly with everybody, but I have to say, regardless of how long it takes, it by God's grace, it works. All
Right.
right. If there is issues of pains and stuff like that, then we know that inflammation is involved. I would normally recommend the use of anti-inflammatory herbs. And one of the combination that I really like is, again, turmeric, ginger, garlic. If the individual has low blood pressure, I normally would suggest, I would not suggest the use of the garlic. All right, but turmeric, ginger, what we call wild turmeric, is also really, really useful if you have access to cat's claw or gully root. That basically really makes the combination even more potent. All right, and that works really quickly, and within a real within a real short period of time, helps to reverse the issue of pains and stuff like that. All right, so again, turmeric, ginger, wild turmeric, gully root, and cat's claw. If you don't have the gully root and the cat's claw, that's fine. All right, the others definitely would work. For some of the individuals, they have also found that adding a little cayenne to that definitely works really, really well for them also. All right, so these are some of the natural herbs that can definitely be used. I think also that we should have on our counter a little onion and honey syrup. All right, I think everybody knows how to prepare that also, but the onion and honey syrup is fantastic for the respiratory system. It really clears the lungs, and it works beautifully. So yeah, those are some of the things that I will definitely suggest.
All right, great. Thank you very much for sharing, and we have certainly taken note to be able to utilize those recommendations. Okay, thank you. So folks, just quickly looking at certain measures that you can take in the morning. Literally, let's, as Brother Diaz mentioned, get serious about our physical environment. It's a mosquito. It's a tiny little thing, but causing a big problem. And if we could eradicate them let's do that. If you're literally having areas around your home that's perpetuating the breathing of mosquitoes, then let's put a stop to it. So you're looking around for any puddles, that way you have little sunken areas in the ground surface that's pooling water. You want to fill that up and or cause it to be drained out. Any containers that can hold water that will create that breathing ground for mosquitoes. Let's get rid of those. Plants or plant pots where water may sort of be stagnant in grassy areas. Let's look barrels and check within your barrel. If you're seeing larvae running around and so forth, you need to treat that or throw it out. You see buckets and paint buckets and tires. All of these are little nice hiding out places that mosquitoes will find. And if you see them, let's spray them or whatever to get rid of them, but check your environment. Here are some personal things that you can do. Avoid outdoor activities at dusk and dawn times. avoid apply mosquito repellent creams to your skin that would be exposed. And even take care of your children. Make sure that you apply some items to the skin of children. We have a little caution though around have it here somewhere. I tell you about the babies would not be able to tolerate things like eucalyptus or lemon. But basically, the more older children wear protective clothing, cover as much of your skin as possible by wearing long-sleeved clothing, long-sleeve shirts and pants. And dark colors tend to attract mosquitoes. So lighter colors tend to keep them away, and use bed nets for sleeping. So now is the time to make sure you get a net if you don't have one and you need to have one. There are individuals who do not have the insect screens, but the mesh protectant screens on their windows. Therefore, you sort of shield yourself when you're asleep by having a net over your bed. And so clothes and bed nets can be sprayed with mosquito repellents as well to keep them off from coming in. Some mosquitoes could be so tiny, they seem to be coming through the nets, but you never know where they may find a little opening. Use mosquito repellent coils or plug-in devices if you don't have anything else that you can use. You can also, we talked about the breathing, empty out water cooler tanks and so forth. Watch your garbage cans, and those are nice little areas. Your dustbins need to be covered. If they're not, and you have a big dustbin and you keep putting trash bags into there, dew and rain could settle, causing water at the bottom if there's no outlet for that water, and nice cozy areas for mosquitoes to breathe. You also want to look at preventing mosquito bites. Try not to get those bites, and staying in places where you have air conditions. That means you have the windows closed, or you have door screens and window screens to keep the mosquitoes out. And then you also want to look around to have enough mosquito repellents with you. Now, we're told that do not use insect repellents on infants under 2 months old. Those are little tiny babies, and we need to take care of them by extending this caution. So for children under 3 years, the oil of lemon and eucalyptus, they have what you call paramethyldiol. And that is an insect repellent in and of itself, but it can be an irritant to the children for their respiration as well as to their skin, being so young and tender. So we try not to use those on them. But for older children and adults, you could spray some of these repellents. Sometimes I would take like a spray bottle with a little water, and then you put the drops of the essential oil in it. Or you can use a cream, put the drops of the essential oils in your creams or in other carrier oils for sure. These oils, try not to use them directly on your skin. They need to have a carrier oil with them. I'll show you a couple of the oils in a moment. Okay, and yes, citronella is good. Now, children in their clothing, so always need to watch out for them. Cribs, strollers, check their beds, check their rooms, because you as an adult might be able to hear the sound of a mosquito and follow it and find it. And children are not able to do that. And avoid having them put the insect repellent into their eyes, ears, mouth, any open areas on their body, any open cuts. Guttering for roofs. Check those, you may have leaves that's fallen onto the roofs, and then they block the outlet pipe from sending water through efficiently, and then you get pooling of water along those guttering areas, and that could be a nice easy point for mosquito. Day one, mosquito belly is filled with blood. She's looking for some area to lay the eggs and will take wherever she finds it. There may be birds. I know on one side of my roof, I have birds just love to build a nest. And the other day I noticed one building a nest quite close to the downlet pipe. And I said, let's go check that and move it out, because it could clog that downlet pipe and you don't get the water coming out as it should. I think we've covered all of the other examples. So take action, reduce the mosquitoes with their breeding sites, cut the bushes that around close to your home. Take responsibility for that. Any derelict vehicles in the yards, you want to secure that, get rid of it, dispose of it. Don't keep these things close to you. It's not fun when someone is sick and they have dengue hemorrhagic fever, and it can be quite detrimental to their health and even have long-term kind of impact on the well-being of individuals. So diet for dengue, really? So as you mentioned about hydration, but certainly when you are unwell with any virus, let's focus on building the immune system. And now is a time where you go healthy. Everyone knows when they think about let's eat healthy, that it would exclude meat, flesh foods, and their byproducts. So let's go on a total plant diet. Watch the sugar, that lowers the immune system and reduces the amount of white blood cells that you can possibly have to fight for any infection for you. So sugar needs to be out. Dairy needs to be out. Processed foods and oils. You just want to have nice, simple diet at that time. Simple food, not anything that's complicated in a dengue type situation. Now, better yet would be to avoid eating the solid foods and go to drinking of water and juices. You can have beets and carrots. Those will be great for your blood, for cleansing, for building your immunity, and even building up your blood supply. Vitamin C is excellent as it helps with better absorption of iron and to build up your blood. And orange juice, for example, as well as lemons, those are quite helpful. Drink as much water to replace fluid loss, and especially if you are building a temperature. And even with pomegranate juice and black grape juice. Now, as I'm talking, okay, just all right, we'll just take a note. Lifestyle for dengue. You want to keep the room aired and sunny, and so you open your blinds during the day. Open your windows. Yes, open your windows and let fresh air come into your room. Even if you need to spray the room afterward, but let the stale air go out, and all of these are nice, healthy practices. And then if it is that you do have a temperature, just applying some cold rags to your body, to your forehead, on your wrists, your arms, your calves area, just some nice wet rags. Wring that out. You don't want it dripping wet, and just apply it. That would soon become heated hot, and you just put some water again onto that, and so these wet compresses. Sponge the skin with cool tap water to dissipate any heat. Keep sponging the skin. If you're a caregiver, you're going to be quite busy. As the person, is so hot, that just helps to with getting rid of some of that heat. You don't want the brain to be heated up too. So, just make sure the forehead to the back of the neck, around the throat area, you apply these cool rags. It's another suggestion about taking a fever bath. If you have a bathtub and you're able to fit the person into that bath and the water temperature is hot, it's like fighting fire with fire to sort of quell that. Another thing too with the fever bath, it's that you're going to ramp up your immune system, that heat. So that's what fevers would do for you. And then just submerging yourself within that hot water tub can also help to build that immune system nicely. And avoid getting the chill. You know, the chill is when you get that shock to your system and your body just, all your pores raise. You don't want that. So make sure if you're helping anyone or yourself in and out of water, that you really cover your skin with a bathrobe or towels and dry up quickly, so that you don't get a chill. The chills can work against what you're trying to achieve. Now, here we have some suggestions about the essential oils. So you want to, for any essential oil that you can pick up at your local health store or any pharmacies, they may have counters where they have these essential oils. You need a carrier oil. Don't put the essential oils onto your skin directly. It can be too harsh and burn. So you want to have a carrier oil like coconut oil, almond oil, olive oil. And I'd say if you had like an ounce of almond oil or coconut oil, and then you put your drops of lemon oil into that, like about 15 or 20 drops of the lemon into that, then you can have that as a mix to rub onto your skin for an insect repellent. Similarly, eucalyptus oil or lavender, neem. Neem doesn't smell good at all. Neem, funky. But neem works. And as much as you want to run away from that neem essential oil, so will the mosquitoes want to run away from them. So yeah, if you had neem oil, that's a good one. Then cinnamon, feverfew, citronella, quite common fragrance and oil that individuals would know to help fight off these mosquitoes. Catnip, garlic. What is a garlic? That might be a prepared one. And lemongrass, basil, peppermint, rosemary, lavender again. So all of these are different types. There's so many options. You most likely have one of them. But as you mix it with a carrier oil or with a body cream, and then you rub that onto your skin, the insects will come close, the mosquito come close and smell it, and then doesn't come to bite you. And so that's what we want to achieve. So we are looking now at, okay, someone is asking what about castor oil, whether that can be used as a carrier. Yes, the only thing with castor oil is that it can be pretty thick and tends to be quite sticky compared to the other oils that's more loose. And so you would, to put castor oil over a large body portion areas might be a bit challenging for some, as opposed to being free with a coconut oil or the olive oil. Those are not as thick. So, all right, and let's see, herbs for dengue. Okay. Now we're looking at vitamin C lemon juice. It's great for vitamin C. Some folks may be familiar with camu camu. That's also helpful, but lemon might be more readily available to you, and use your lemon. Even if you don't have lemon in stock, you may have lemon juice that you could purchase from your local supermarket. It still helps, it still works, and secure some. You also find that oranges can be used as well. So any form of vitamin C you want to have. You can also take vitamin C capsules, and that can be good as well. Rose hip or just vitamin C, but bioflavonoids, all of those are good options. Probiotic, any kind that you have locally available to you, you want to address the gut health. And so that would help to build your immune system to fight off this particular virus quite quickly and help with your recovery. And so as you would be working on good juices and fruits, eating your fruits that will also have vitamin C in them, taking a probiotic can be helpful. If you're vomiting and you took a probiotic, that can help to stop the vomiting also. Golden seal and oregano oil are other options that can be used. Golden seal, it's quite natural to the system, and that can be helpful. Oregano oil can be used as well in these cases. And so if you have oregano oil, it's 10 drops of the food grade oregano oil to 1 tablespoon of olive oil. And if you took that at night and morning, then that could be also helpful to you. Echinacea, you can have that in capsule form, or you can make a tea with echinacea and drink through the day for about 7 days, and that should take you nicely 4 tablespoons to 4 cups, making it pretty strong. And you draw that in hot water for 40 minutes to 3 hours. You would strain and drink that for 7 days. You want to reduce fevers. Coriander can be quite helpful. Peppermint, fenugreek, these tend to cause you to increase perspiration. And if you start getting that fluid out of your system, then it's like a natural water sprinkler onto your skin to help to cool you down. So making teas with these items are helpful, and they also tend to ease the pain and promote sleep. Fenugreek. So for fevers, any of these are helpful. Well, by now, you're probably looking at your pawpaw tree and saying, well, I'm glad I have one, or if you don't, try to get one, because your pawpaw leaves gonna come in quite handy for you. Or usually within the tropical areas, you see God has placed the same items that we would need to benefit for fighting these conditions. So pawpaw trees are quite common, and these can help to increase your platelet count. Now, here's what you need. You need the juice, the raw juice of pawpaw leaves, and 2 tablespoons can help. You are going to take 2 raw pawpaw leaves. You want the leaves and not the stems. You don't want the stem, you just want the leafy part. And then you can pound them, squeeze them in a cloth and just squeeze it, and you get that juice. That's a nice one way of getting it, quite potent. And once you have that juice, you're going to take 2 tablespoons of it and drink that. And once you do, it's going to help to build up your platelet count, which will cause you to feel very weak, as well as have your blood overly too thin. And so you want to make sure that you use your juice. You want it raw, as opposed to boiling it or adding anything else to it. Barley grass, if you are living in an area where you have barley grass available to you, similarly, you want to drink barley grass. You can make a tea or you can eat it straight, and that can help to build up your blood platelet levels. Neem, again, 2 tablespoons or 2 capsules twice daily. You want to steep the leaves of the neem, and then you can drink it. So get a couple of neem leaves and you just add that to a cup of hot water and you let it draw. And when that happens, you can drink it. And it can help to improve your immune system and to return your strength. A lot of folks talk about feeling weak, so the neem can help to get you stronger quicker. Basil leaves, 10 to 15 basil leaves, chewing on that twice a day. These can also be drawn and make a tea out of it, and you drink your basil leaves. And turmeric, 2 tablespoons of turmeric, making a tea. That can go in like about 4 cups of water. But it's known to help to boost your metabolism and for helping to the healing process. If you have turmeric capsules, you can use 2 capsules twice daily. Kelp, you find that kelp, chlorella, spirulina, all of these, cat's claw, these are other options that can be taken. These help to build the blood supply, and they also help, you know, to build up your white blood cells. We would seek to regulate any low blood pressure by bringing that up with some ginger can help to bring up your blood pressure. Some pink Himalayan sea salt as well, and licorice root. If one does not have high blood pressure, then using licorice as a tea can bring it up into and regulate it for you. To reduce internal bleeding, cayenne can be helpful. White oak bark and yarrow can also be helpful as drinks and to stop any internal bleeding. Now, interestingly, you know, I recall some years ago that we had worked with an individual who was in the hospital and for dengue, and that blood count was dropping very low. And we actually suggested juices to the family, and they were able to make the juice and get help. The person was able to drink the juice, and that platelet level went up, and they recovered with their strength, and everything went well. So you're looking to increase chlorophyll within the blood, and that would increase your blood count. So any green item, green leafy, wheatgrass, barley grass, alfalfa, spirulina, chlorella, kelp, blue-green algae, all of them are helpful. So here we have options of juices where you can see items in here to build blood, vitamin C. You also have you know, those which would help to increase platelets, and there are quite a number of them. But if you don't have all of them, you certainly using as many as you have can go a long way. And you know, getting some zinc and copper in here with your blackstrap molasses, some calcium to help. All of these will go towards helping to build your blood. So examples of these are like beets, celery stalk, lemon juice, with the peel and the rind, and you're juicing these items. Spinach, kale, kelp powder, we're putting that back in to help with supporting good thyroid health and keeping up your iodine levels. And then you have alfalfa or spirulina or chlorella powder. These are quite powerful. And tahini butter, sesame seed, or blackstrap molasses can work nicely here. Add some ginger, and you know, you juice that, and you can also have coconut water going along with it. If it is too thick, if your juice is too thick, you can add some coconut water to it as well. And other options: carrots, fennel, lemon juice, spinach, lettuce, kelp, alfalfa, all of these come back in here again. And green apples, lemon, sweet pepper, cucumbers, kiwis, tomatoes, great source of vitamin C and to help. So if you did these over the course of your days, and remember, lots of juices, lots of fluids, water intake, then that can be quite helpful to you. And drink it with a straw slowly. You don't just want to gulp it down, but just sip, sip. I always have to tell folks, I gave you a straw because I want you to sip, sip at the juice. Don't just drink it down. People would say, well, I want to get it inside of my body quick. Yeah, good. But you want to take it in gradually. And as you do that, it would be absorbed nicely within your system, within your blood stream, and become quite helpful to you. You also want to mix that along with the saliva in your mouth as you drinking it slowly, and that would help for better absorption and in your system. Having these items on an empty stomach would work great so that it can get into your bloodstream pretty quickly. And so if we were to follow these, and then as Brother Diaz mentioned earlier, using turmeric, ginger as a tea, and if you were to drink that, if you do not have low blood pressure, then you can have garlic added to it, turmeric, ginger, and garlic, as well as cat's claw and golly root. So those are some additional items. And there is just one more item that I'd like to suggest for the fever as well. And this is something that I've seen work for normal fevers, COVID fever, and can even be helpful with a dengue fever, is the use of vitamin C on the skin. So what we would do is to take lemon juice, or even you have some coconut oil, you can use olive oil, any oil you have, and you pour lemon juice in that. How much? It depends on how this, if it's an adult or a child, you just want enough to be able to rub that mixture of vitamin C, as in your lemon juice. Lime juice can also be used. And the juice of lime, the juice of lemon, and an oil that you would need. And you'd mix that together in a dish and then just rub the skin, the bare skin. Rub the head, the face, suck the head with it. Rub all over the body, front, back, legs, under the feet, everywhere. And then you cover the person up with a sheet and let them rest. And what happens is that the fever will dissipate, and that works really nicely, quickly as well. And you want a fever down. You don't want fever is an indicator. It's fighting off an infection. Yes, great. But at the same time, you want to know that you're overcoming the infection. And so you're going to do whatever to help to lower temperatures within the body. You don't want to burn up. So apart from applying all the wet compresses to the skin and so forth, using the vitamin C with juices, as in lime or lemon, and along with some oil that you could rub it onto the skin, can be helpful. And couple with this, nothing hurts by putting the person out into the sun for the fresh air and sunlight. Sunlight can help to get rid of infections. And even in this situation, it can let the person rest, but not too much that they are not able to take care of themselves. If you could walk still, you have some symptoms, but again, prevention. So even now, let's seek to build up ourselves and our immunity with getting that sunlight, fresh air, exercising. You find that individuals who exercise, they always do better in fighting these conditions when it comes to them. Nutrition plays a big role in terms of going on a total plant diet now, having less inflammatory foods in that diet, and then water, drinking lots of water, and just trusting in God to take care of you. So as we look at our environment externally, internally, and apply some of these things to our bodies, by God's grace, you will be able to overcome dengue. Lots of others who've gone before have done similarly and was able to come through well And so if you were to practice this, then it will do well for you. Dengue is a serious situation, so we want to give it full attention from the onset. And also, if you find that you do have the fever setting in, watch that. If it is increasing, certainly get to a healthcare facility. You don't want it to get into that severe state. And if it does, you would need help. Getting a dengue shock syndrome can be quite life-threatening, and therefore you want to get the support that you need. So with that, okay, we have come to the point where if you do have any questions that we can take quickly, someone is asking, what about liquid chlorophyll? Liquid chlorophyll can be helpful, but I'll suggest still work with the juices and the real leaves and that sort of thing. Use what you have, but seek to get some of those things because it helps and it makes a difference. You want fluids. So liquid chlorophyll is only going to go so much, but you want a lot of fluid. And some people would even put that liquid chlorophyll into their water, but drink up. What I use in Guyana, neem leaf, coconut oil, and 2 cloves of garlic, and I mix them and leave it for 3 days, and then I use it on the skin, okay, for an insect repellent. Wow, okay, wonderful. Garlic can burn the skin, folks, or notice the individual has mixed it with a carrier oil, coconut oil, and don't put overly too much because you don't want to burn your skin. Wonderful. Thank you, everyone, for your attendance and participation today. I don't know if we have any more questions. Anyone would like to unmute to share anything with us? I mentioned something earlier with aspirin giving to young children could cause Rye syndrome, and you don't want to give it to aspirin to children unsupervised. So don't, just be cautious about that. Okay, so anyone questions? Last call? Yes, Brother Diaz.
Just one thing I would also like to recommend. There's a natural spray that you can put together. It's cheaper than anything else that you can prepare. Just get yourself some Epsom salts.
Right.
You mix about 1 tablespoon of the Epsom salts, or 2 to about a gallon of water. All right, and you can put that into a spray bottle, and especially for the children, when the children is going out to play, you can spray it on their clothing. You can even spray it on the skin, spray it in the hair. There are particular components of the Epsom salts that doesn't just repel mosquitoes, but it basically kills them. If you spray it around the yard, spray it on the plants, spray it on the walls of the house, wherever mosquito sits, you spray it. And as long as the mosquitoes basically make contact with that, I think you're going to start recognizing that, you can eradicate the presence of mosquitoes, in and around the home by doing that. If you have conditions where you may have water settling and, something that you can't control, take a little Epsom salts and just throw it in there. All right. And that really works beautifully. All right. So that's something that I did not want to forget. So it really works beautifully.
Okay, wonderful. Thank you. And Epsom salt is quite reasonable. Yeah. Okay, great. So I just want to share with everyone. I'm going to post in the chat our YouTube channel where this session has been recorded and will be posted up on our YouTube channel for us to be able to get access to the recording later on. We also have a WhatsApp group, and I've placed it there, WhatsApp group, that second link. And if you click in there, you would be able to join the WhatsApp group where we put announcements and share certain things with you as we progress in our discussion. And just want to extend by way of announcement. We have coming up, starting next week, our residential program, and this is for the August enlisting, and so August 5th to 25th, we will be having our residential program, followed by the months of October, November, and December. And here individuals can have an opportunity where, should you have any health-related challenges, that you could come by, apply and register for any of these programs, where you will come into our health facility and be taken care of and learn how to take care of yourself with your particular condition, so that when you go back home, you're clear about your path and your plan to be able to prepare your meals, how to prepare your teas, how to apply certain situations, care to your particular health issue. At the center, we also offer massages and hydrotherapies and saunas, all of those that are geared towards different situations. We help individuals with heart disease, reverse diabetes, hypertension, and more, as well as weight loss and COVID issues and cancer remedies. I just want to let you know that next year we will have an entire program just catering for weight loss. So it's something to look forward to for that announcement, and the dates will be posted pretty soon. By next week, I'll be able to share with you our website, where you would be able to go and get everything on one website. So we're just putting certain things across, where one website you'd be able to get information about the Lifestyle Center, about training. We have medical missionary training coming up in September for those of you who are local in Trinidad and Tobago, where you can come and get hands-on and be able to participate in our internship program as well. So these are just some highlights as to what to look forward to, and more information would be shared with you in due course. So without any further ado, I'd like to close out this session with a word of prayer. Heavenly Father, we give you thanks for all of our participants and individuals who shared on this platform this evening. We know that we're living in a time where pestilences are all around us, but we thank you for the natural agents that you provided and the wisdom to help us to learn how to apply it, and therefore gain relief and even recovery. We ask you for your continued grace to be with all. And this is our prayer in Jesus' name. Amen. May God richly bless you. Thank you, everyone.